Also known as a sugar pill, a placebo is a type of remedy that is both useless and useful at the same time. It's a fascinating window into the power of our minds. A placebo is essentially an inactive substance or treatment, like a fake pill or sham surgery. But it can still produce real, measurable effects. The key ingredient: belief. When we believe a treatment will work, our brains can trigger physical and psychological changes, even if the treatment itself has no active ingredients. A 2013 survey conducted by researchers at the universities of Oxford and Southampton revealed that 97% of UK doctors have prescribed placebo treatments to patients at least once during their careers. The study, which included responses from 783 registered doctors, distinguished between impure and pure placebos. Impure placebos. Used by 97% of the doctors who responded, these include treatments with unproven efficacy for certain conditions, such as antibiotics for suspected viral infections or non-essential physical examinations and blood tests performed to reassure patients. Pure placebos. 12% of doctor responses cited treatments like sugar pills or saline injections that contain no active ingredients at all. The primary reasons for prescribing placebos were to induce psychological treatment effects, fulfill patient requests for treatment, or provide reassurance. Ethical views varied. 66% of doctors considered pure placebos ethically acceptable under certain circumstances, while 84% deemed impure placebos acceptable. However, over 90% opposed placebo use if it risked undermining patient-doctor trust, and over 80% were against their use if it involved deception. So, how do we get fooled by placebos? Our brains are incredibly complex. When we anticipate a positive outcome, our brains release chemicals like endorphins, our natural painkillers. This can reduce pain, alleviate stress, and even improve motor function. It's not just in your head, it's a real neurobiological response. Placebos can be crucial in clinical trials. They help scientists determine if a new drug's effects are truly due to the medication itself, or if they're simply a result of the placebo effect. You may have heard about an experiment or trial using a control option. Well, this is a placebo, whose role is to make it a fair test. Let's look at some real-world examples. Pain management. Placebos can significantly reduce perceived pain. Studies show that patients who believe they're receiving painkillers often experience relief, even if they're only given a sugar pill. Depression. Some studies have shown that placebos can be surprisingly effective in treating mild to moderate depression. The act of receiving treatment can trigger positive changes in mood. Parkinson's disease. Research has even demonstrated that placebos can trigger the release of dopamine in the brains of Parkinson's patients, temporarily improving motor function. It's important to note that placebos aren't a substitute for real medical treatment, but they highlight the powerful connection between mind and body. An episode of a BBC program called The Doctor Who Gave Up Drugs featured an experiment comparing 14 commonly prescribed antidepressants against a placebo. Professor Andrea Cipriani analyzed every available study on the effects of these drugs on teenagers' brains and compared them with a placebo. Only one drug, fluoxetine, had better results than the sugar pill, and even then, the quality of the evidence was low. Similar to a placebo is the famous Pavlov's dog experiment, where the scientist demonstrated brain training by association. Pavlov rang a bell just before feeding his dogs. Then, after practicing this routine, the dogs learned to associate the sound of the bell with feeding time. Eventually, the dogs would salivate at the sound of a bell, as the brain had been coached into associating the sound with the ritual of eating. This experiment demonstrates the basics of conditioning theory. Let's say someone takes a drug such as a painkiller, and then always does a certain activity such as sitting in a certain room or being exposed to a particular smell. After repetition of that routine, the brain may start to associate the ritual with the medical effects of that drug to such an extent that the user could experience the effects of the drug, even if the ritual were done alone. The placebo effect is a testament to the remarkable power of our minds. It reminds us that belief, expectation, and the mind-body connection play a crucial role in our health and well-being. While ethical considerations are important, the placebo effect continues to be a fascinating area of research. Understanding it helps us unlock the potential of our own minds. If you found this video useful, please be a gem and give it a thumbs up. Thanks. So next time you take a painkiller or vitamin tablet or eat some healthy food, make sure you're conscious of the benefits. You might just get an enhanced effect.